The transformative shifts occurring in the healthcare industry today are creating seemingly endless opportunities for both industry incumbents and new entrants to disrupt the marketplace. But in order to benefit from these new opportunities, organizations will also have to navigate the financial, strategic, and ethical risks associated with the future of health. This is Tales of Transformation. Today, I'm joined by Jennifer Malatesta, Omri Junadine, and Simon Gisby. Welcome to the show.
Thank you. Glad to be here.
Thank you.
Thank you.
Organizations continue their journey toward the future of health. Taking calculated risks could help improve value for customers and build competitive advantage. Omri, how do you think organizations can better integrate risk intelligence into their overall strategy?
The future of health offers incredible opportunities for those inside and outside of the current healthcare life sciences ecosystem. Now, as with any venture, though, risk has to be managed in an intelligent way, so you basically take advantage of the opportunities while managing the risk. So from that standpoint, I can offer three potential tips, so to speak. The first one is establishing a robust strategic risk management system. You want to integrate strategy and risk management stakeholders. Typically what happens is risk almost sits outside the bounds of strategy and those people making strategic decisions. The theme here is to make sure that the risk process is integrated into the strategic decision process. The second one is really to adapt an outside-in perspective and invest in risk intelligence programs, also to use digital platforms to sense and analyze evolving marketplace factors and certain variables that will aid our decision-making. And my final tip is really to offer advice and training on some of the newest kind of risk management approaches and strategies to leaders that are making those strategic decisions. Along with this concept of bringing them along the journey, how do you educate them on risk management and, quite frankly, taking advantage of some of the risks out there and turning them into opportunities?
I think risk management seems like it should always be at the top of any enterprise. With increasing consumerism in the life sciences industry, product quality and transparency will become even more critical. Jen, how can organizations more proactively improve their quality measures to mitigate safety risks before they arise?
I think it's really important to understand the pace of innovation and change in the environment right now. The ecosystem with which these companies are operating is getting more and more complex. To really ensure that companies can move quickly and take advantage of those types of opportunities, they really need to be sure that the basics are solid. And that really starts with the enterprise safety and quality management systems. Those systems should be nimble and, at this point, tech-enabled. As innovation in marketplace accelerates, those safety and quality management systems can be tested. Specifically, safety and quality requirements can shift rapidly as firms start to experiment with new technologies, new treatments, or even new business models. Taking it a step further, firms should really be investing in social media monitoring and other tools to really understand what patients and consumers are saying out there about their products. The other aspect of safety that we can't forget about is the role that third parties play in the ecosystem and the increasing impact that third parties are having on the safety and quality landscape. There is increasing usage of contract manufacturers, contract research organizations, and just a plethora of outsourcing in these firms. Each and every one of those organizations could have an opportunity to impact either positively or negatively patient safety and quality. To really be sure that firms understand to what extent that's happening, there should be some periodic third-party safety and quality inspections on vendors, but also on the broader supplier network. Lastly, and this is probably the most important, is that as innovation happens, technology evolves, and new treatments are explored, we're really going into new territory around patient quality and safety as we look at gene therapy, connected devices, etc. It's really important that firms reach out to their regulators and enter into a dialogue very early on about the implications of patient safety and quality. Bringing the regulators along for the journey, while sometimes there's some hesitation to do that, can actually increase the speed to market and could actually accelerate the approval process as new therapies and innovative devices are explored.
Simon, what are some new ethical implications that will be introduced in the future of health that companies haven't had to monitor as much before?
As Omri mentioned earlier on, there's a need for risk integration programs. And Jen mentioned our clients now have to monitor social media to track adverse events. And what we're seeing is life science healthcare companies now have to engage in a different set of data analytics. The underpinning of future of health is this move from health to wellness. And that means thinking about social data sets, environmental data sets, financial data sets, as well as healthcare data. And in all candor, life science healthcare companies aren't very good at thinking about managing and securing those other data sets. It's not a core competency. But similarly, other players who are entering the space, the tech companies, the consumer product companies, aren't well versed to manage healthcare data. So you've got some questions around who owns the data, who's responsible for data security, given we are amalgamating all these different data sets to drive to those superior clinical outcomes. Huge use of self-learning algorithms, AI. But again, it's that question around who's responsible for the data that is being used to run those AI programs. And if it's flawed data, does it lead to bias? Quite often unconscious bias.
So we've discussed a lot of emerging trends throughout this season. Jen, how can organizations successfully explore new business models being driven by those trends?
This is one place where the marketplace is absolutely changing and will really never return. A basic fee for service is really a thing of the past, and the marketplace is demanding more of a connection between compensation or reward and value. And value-based constructs out there in the healthcare ecosystem are really challenging to design and administer. Those systems are especially important when competing for patient contracts or contracts with large medical institutions in the ecosystem. Having the ability to offer a value-based arrangement is going to be critical going forward. Today it's a differentiator. Tomorrow it's going to become table stakes. Additionally, it's really important to align with partners to co-develop this innovative healthcare delivery and payment models and really work through the risk-sharing agreements. Complementary organizations such as healthcare institutions and pharma companies can also collaborate and create a risk-sharing organization. It doesn't need to be just the traditional pharma and payer model.
This is a really exciting new world that many of the organizations involved in the industry and those that are trying to enter the industry are embarking upon. It's really about making sure that integrating risk into all of the strategic decisions that we make and take advantage of all the opportunities that come with it. It's a great time to be in the industry.
I think the biggest risk is to convince ourselves that the industry is not going to transform. And if we recognize that it is, and we can embrace the risks, there are some great opportunities to be explored.
So with that, I appreciate all of you coming on board. Embrace the risk. Jennifer Malatesta, Omri Junadine, and Simon Gisby, thank you so much for joining me today on Tales of Transformation. Stay tuned for Season 5, where we'll dive into interoperability. Thanks for listening to Deloitte's Tales of Transformation, sponsored by Deloitte's Life Science and Healthcare Practice. This podcast is provided by Deloitte and is intended to provide general information only. This podcast is not intended to constitute advice or services of any kind. For additional information about Deloitte, go to deloitte.com/about.